Okay, so your objectives are going to be to stay awake and to learn. And the other ones we'll go over later in a little more detail, but for now, just focus on stay awake and learn. I have nothing to disclose. I have the greatest job in the world. I am over 5 departments, and I will tell you all about them in exhausting detail. I also have a bio up. You can skip most of it, but the last sentence is, besides a passion for healthcare, Aaron's great devotion are for his family, naps in a hammock, good cheeseburgers, and bad puns. A little bit about Scripps, for those that don't know us. We're in San Diego, California, so we're south of Los Angeles and north of Tijuana. We have 5 hospital campuses. We have 32 outpatient clinics, and we're a private, not-for-profit, integrated health system. Now some quotes from people that are much wiser and smarter than myself. The first is, you can have it all. You just can't have it all at once. And that was Oprah Winfrey. The second was, life is like riding a bicycle. To keep your balance, you must keep moving. And that's by Albert Einstein. And those 2 you probably have heard of. The third you may not have. So this is Brian Dyson, and he was actually a CEO at Coca-Cola. They make beverages, for those that don't know. And so he had a really interesting talk he gave once. It's sort of like the opposite of what you expect from a CEO. He said, imagine life is a game in which you're juggling some 5 balls in the air, and you name them work, family, health, friends, and spirit. And you try to keep them all in the air, you try to keep them going. And soon you'll understand that work is a rubber ball, and if you drop it, it can bounce back. But the others, family, health, friends, and spirit, are made of glass. So if you drop these, they can be irrevocably scuffed, marked, nicked, damaged, or even shattered. They'll never be the same, and you must understand that and strive for balance in your life. All right, everybody ready to buckle up? We're going to do 5 balls in 40 minutes. On your mark, get set. There you go. All right. Patients, operations, self, staff, and organization. So starting with patients, this is where I preach to the choir, because all of you have chosen to come to a Healthcare Advocate Summit, so you don't need me to tell you patients are important. We have a healthcare practitioner sitting at her desk, and she says, this is perfect for me. I got into medicine for the love of paperwork and regulations. Depending on your setting, the way you interact with patients can be very different. Some may do virtual and phone, some may do face-to-face. These days, I consider myself 2 degrees of separation. There's the people that directly interact with patients, there's my staff that help to support them, and then I support and manage my staff. So it gets harder and harder to see your patients, especially from your ivory tower. Back when I was an inpatient manager, I actually would schedule time every week to go in a different patient care unit. I would walk the unit, and I would go in and visit patients to remind myself why I was there as an operations manager. Nowadays, I sometimes have folks that have to sign paperwork with my financial assistance, patient assistance techs. So if those patients come in and sign paperwork and I see them, I try to take a few minutes of their time just to interact with them. Again, to remind me what we're here for. The other time I tend to interact with patients a lot is the let me talk to your manager. People that are real upset for whatever reason, because healthcare is frustrating. And they say, let me speak to your manager, and people send them to me, and I try to help them, or even just to be a good listener. Planning time with your patients is an important time investment, and you can schedule it, or it can be unscheduled. It can be what I like to call getting your steps in. So if you have like a phone or a watch that counts your steps, maybe there's a really direct way for you to get from your office to your car and back, or from your office to the subway if you live in a big city. Instead, take the time to go a roundabout way that gives you a chance to interact with patients. And the other is changing your mindset from, oh, I have to do this, where it feels like a chore, to I get to, sort of like this treat you get. I get to interact with patients. Again, for some of you, maybe not an issue. Going to move on to operations. And so for some of you, operations may feel like this. Has anybody ever played the game? Where you have to take out the little bones and it zzz. So how often do you get that zzz? Are you getting it annually, monthly, weekly, daily, hourly, zzz, minute to minute? So in my current job, I'm over 5 departments. I have them listed below. And sometimes that zzz happens more often than I like. The first one I'll talk about is our medication central prior authorization team. And so for some of you that have worked in pharma, I may have talked to you or to your colleagues as part of this prior authorization process. Currently, the team is nearly 100% off-site work. They are all approved to work from home, and they've been that way since COVID 2022. The team was launched in 2018, now has 14 FTEs and almost no turnover. Team is very heavily dependent on technology. Software, Epic is our EMR. We have a third party, happens to be CoverMyMeds, that's integrated and separately. We have an automatic call distribution phone tree. We even moved from paper fax to electronic fax back in 2020. There's a lot of communication over instant messenger with Microsoft Teams, which if you work for Microsoft, I'm not trying to make you mad, but it can be a blessing and a curse. That real-time ability to ping each other can be really great, but also someone is in a bad mood or someone's feeling really chatty, it can definitely interact with morale, interact with productivity. The needs from me operationally tend to be about 20% technology, 10% clinical, and 70% is what I call emotional and relationship support. And that could be with each other, it could be with my staff and clinic doctors and nurses, with patients. Over the last 3 years, our productivity measures have gone up, up, up. And over those same 3 years, our employee engagement scores and satisfaction have gone down, down, down. We use Press Ganey. And so I've done a lot of thinking about that. And part of it is it's really hard when you're working remotely to feel connected. And part of it is who loves insurance? These folks, all day long, their job is to fill out insurance paperwork and sometimes, butt heads with or try to convince insurance companies. And that's hard. It's really a hard job. Second one is our Medication Patient Assistance Program, our MPAP. And these are the Fab Four. For those of you a little younger, there was a musical group from England, from Liverpool, I believe, called the Beatles. And so they were called the Fab Four. So that team was launched just the beginning of last year with our Epic module in May of last year. I actually had an opportunity to give a presentation at this conference. And so if you want, I put the link. I see a few of you are gluttons for punishment. You came to my talk last year and again this year. Currently, that's all on-site work. They have to come into the office, and that's because of the personal financial information they have. They have access to information that the organization is not comfortable with people having at home. Operation needs for me tend to be 40% technology, 10% office and facilities, and about 50% what I call emotional relationship support. It's about a year in, just over a year in, and so the technology, we're still working out some of the kinks. The next is the Scripps Central Pharmacy Production Center. And so this is actually a production center that produces compounded sterile products, medications, as well as doing trays and labeling and other support. So that was launched, 11 years ago, and has 10 FTEs. We have 3 separate Board of Pharmacy licenses. Has to be on-site work because the work they do is physical production center. They make about 34,000 compounded sterile products for use at the 5 hospital campuses per month. We also do ambulatory surgery center trays for 3 different surgery centers, and we do emergency kits and pediatric kits for the clinics as well. RFID labeling, and then operations needs, again, from me, are about 30% related to compounding and facilities, 30% regulatory, and about 10% emotional relationship support. They have a dedicated supervisor that helps with a lot of those minute-to-minute issues. Telepharmacy. Again, this one was also launched in 2012, and it has 19 pharmacists. They're a hybrid of some on-site work and some off-site work. So they used to be 100% on-site, 0 work from home. COVID hit, everyone could work from home. And now it's actually based on performance. So it's a carrot that you can set out for people that are high performers, high productivity, low error rates, good performance evals. Then you can qualify for hybrid work where you get to work from home for part of the week and not have to sit in traffic. They supported the hospitals many years ago with order entry. So they used to actually get handwritten orders from providers, doctors, and they would enter it in the system. And then when we moved to computer physician provider order entry, then we changed to something where they do order verification, dosing, and things like that. So the idea is they can do all the stuff that an on-site pharmacist could do at the hospital, except for physically touching drugs or approving them. They can do it remotely. And they've actually expanded in the last year and a half to doing some clinic work for oncology infusion centers. Operationally, from me, about 20% technology, 10% office and facility, 20% clinical, 50% emotional relationship support. And in this this group has a dedicated manager, Yulia. She's over telepharmacy and SSRS. Last but not least is the Pharmacy Scripts System Resource Services, or SSRS. This is an internal float pool. So these are folks that are full-time or part-time employees of Scripps, but who can float instead of hiring temps or instead of using outside registry. So these are kind of the people I think of as the Old West gunslingers going from town to town. So you can see here's Clint Eastwood. He's cruising into town as part of our SSRS pharmacist or tech. He's going to go to the Scripps facility behind him, right next to the jail. 100% on-site work, relatively short time that folks stay in this role. Operational needs can vary, lots of variety, very little consistency. We have 17 pharmacists and 8 techs. And very rarely does the supply of staff meet the demands from sites. So this is a lot of the relationship part of how do you allocate, how do you settle disagreements when everybody wants more staff than you have. Are we doing okay, or am I going too fast, too slow? Yeah, okay, cool. All right, so operations is what I like to call the juggle within a juggle. So you want to make sure you schedule time, you specifically book time to meet with your staff, review and re-review what's working and what is not. Delegation. Not every process or problem is yours to solve, own, or control. But part of that means you have to let go too. You can't delegate it to someone else and then micromanage how they do it. It doesn't help you and it doesn't help them. Standard work. There are so many different standard work tools, and if people want to discuss them, we can certainly meet out in the lobby. I can go over some. But you want to pick what works for you and works for your staff. The work is standard, but how you get to the standard work is not. So here's Mr. T. Mr. T says there's an SOP for that, fool. Oh, for those that are younger, Mr. T was a really tough guy back in the 80s. He had a mohawk and lots of gold jewelry. Okay. Know what can wait or what doesn't even need action. Problems, issues pop up all the time, and I'm amazed that sometimes the ones that you think you have to jump on end up resolving themselves. Maybe not even you intended it to. It comes up as this is a huge, big issue, and I didn't even see it because I was in a meeting or off-site. And then by the time I saw it and tried to spring into action to fix it, it had already been fixed, or it turned out it was a miscommunication. Build in fire time. No matter how well you plan, weird, bad stuff is going to happen. And so expect to see fires, expect to see things come up that are going to take some of your time, and build that in. And this one, I am the worst on the planet, but setting limits, knowing that if you're going to be away from work, what the limits are for contacting you. And I'll give a couple of real brief examples. One was Disneyland. Years ago, I had a BlackBerry. Ooh, for those of you that were younger, a BlackBerry was like a smartphone, but it wasn't that smart, but it was really good at email and text. It had like a tiny keyboard on it. I was at Disneyland and my BlackBerry, and I was getting onto, I can't remember if it was the Matterhorn or Big Thunder Railroad or what, Pirates of the Caribbean, maybe? So, and I was like getting in, yo, ho, yo, and they're like messaging me for, oh, we need help with this. Just last year when I came here to speak, I was at the World War II Museum. For those of you that have a chance, it's an amazing museum. But I was at the World War II Museum, and I was getting like calls and emails and texts about things that were urgent, had to be taken care of right away. I remember one time going camping up in the mountains in a tent, getting messages while in a tent camping and trying to see if I could find a signal for the phone. So last year in December of last year, I had a chance to go to the Milford Sound. Show of hands, does anyone know where Milford Sound is? One. It's a great question. What state is it in? Well, I'm going to give you the answer, so you won't leave it. Okay, so this is the Milford Sound. And this is in the fjordlands of southern New Zealand. And I'm from San Diego, California. So if you go over to the west coast, I was very far away. And I was away for a while, longer than I like to be away from my family. And this is a picture of what it looks like there. And I will tell you, there is no phone reception. There is no internet. They do have a couple of satellite phones in case they have to call helicopters to helicopter people out if they get injured. But outside of that, there's no communication at all. And a really strange thing happened. I went, and I did this, and I came back, and all 5 departments continued to exist. There were things they missed, and they said they missed me a lot. I had about 1 million emails, but they didn't, not being able to get me and instantly get an answer or a fix didn't cause their world to end. Okay, I got to keep going, because like I said, I got a lot of slides. Yeah, the phone, thank you, dear. Yeah, the phone broke. It broke. I guess the pirates were a little too raucous, and so the phone broke. That's true. Okay, so we're going to do some standard work, and the take-home point here is not that you see the individual standard work, but you get across that you want to make sure it's a methodology that works for your staff. So the first is, these are the compounding folks, and a lot of them don't necessarily stand at a computer. They have to be in areas where they're doing physical work, and some of that just doesn't include computers. So for them, it's steps with pictures, short, 2 pages or less, and things that can be laminated so that you can bring them into the compounding rooms or the other areas. The second one is the telepharmacy. And just to remind you, these folks can do order review for 5 different hospitals that can be very different in their patient populations and approaches, and for 32 clinic centers. So for them, it's giving them a huge amount of information and letting them be able to shop for what they need. Lots of details, all encompassing, user-driven. Really deep, deep pool, but they have to guide themselves to it. So for this is a SharePoint, and the SharePoint just allows for a lot of self-driving and a lot of deep dive info. These are people that are always working on computers. The next is the financial assistant, patient assistant people. And so for these folks, we actually had a project manager when we launched it, and the project manager used a Visio. Are you all familiar with Visio? Yeah, okay. So Visios, I found, is kind of a love-hate. Some people see this, they see a Visio, and they go, oh, it all clicks, I get it now. Some people see this and they go, you couldn't possibly give me something that's less useful. This is so useless to me. And so this group mostly was in the hate area. So we gave them some tip sheets, developed tip sheets that helped a little more. But ultimately what they wanted was 3-ring binders printed out with dividers and a table of contents at each of their desks. So did I say, no, you can't do that. No, that's what you say you need, then that's what I'm going to give you. So that's what we did, was to print them out and collate them and do all that kind of stuff and give them a binder where they could look things up. The other thing was, it was hard for them to follow the standard work. Before that, they either weren't in this role or they did things totally manually with manila folders and stacks of paper. So I had to run weekly reports that would show where they weren't doing the things they needed to do using the technology that we launched, and so bringing them back and showing them. So that was weekly reports, providing feedback. The last example of standard work I'll talk about was for the prior auth team. So for this team, they didn't like SharePoint. You could never make a binder for how to deal with all the PBMs and all the medical insurance. It would be like a binder that stretched from here to the moon. So trying to standardize the madness. And again, if any of you work for insurance, I'm not trying to pick on you, but you might be at the wrong conference because you're going to get beat up here. But yeah, so they wanted to share drives, like a W drive, a shared network drive for resources. And then the other thing I found was there would be so much that we had to have monthly or every 2-week staff meetings. So I'd cover stuff at staff meetings, and some people would really get it. Oh, it was great. And some people would go, well, you never told us that. Well, I did. It was in the staff meeting with the PowerPoint slides. So I had an idea. We ended up doing pet pictures. So everyone would submit me pictures of their pets. It could be babies, whatever you want. Something fun that you would submit. And I would randomly pick a few, and I would put them somewhere in the presentation. And when I got to that person had 30 or 60 seconds to just tell whatever story they wanted. And they didn't know when it was going to come. So suddenly Vanessa's comes up with her little Frenchie, and she would get 30 to 60 seconds. And people paid attention because they weren't sure if their pet was going to come up and what they were going to say about it. And they liked it. So it was funny. We did that for a couple, and then I thought people were tired of the pet pictures, so I went to other things. I had one where it was like slides on ergonomic stretches or things like that. And they were like, big yawn, go back to pets. Okay. All right, moving on to self. So for self, we're talking about family, health, friends, spirit. So again, those are the ones Brian Dyson had separate balls for all of them. I've combined them into one ball. So if he ends up quoting me in the future, then he can say I got it wrong. With family and friends, last year, for those of you that were here, I had pictures of my kids, including when they were toddlers with their bare bottoms showing. So this year I was told no bare bottom children. So I've stuck all to pets, no humans. Maya Angelou said, as you grow older, you'll discover you have two hands, one for helping yourself and one for helping others. And in my mind, it's easy to forget self-help, but that ends up being time not that you get, but that you borrow, have to pay back with interest. So we're going to pause for pets. First is pets can keep you grounded. So quick question, what's the difference between this bunny rabbit and this bunny rabbit? Does anybody know? It's the same rabbit. So the first one is Bum Bum, B-U-M, B-U-M, when she came from the pound, skinny, timid, trying to figure out what the world is like. And the second one is Bum Bum now, after several years in our house, realizing that she runs the place and we are all her servants. So for those of you that have cats and feel like cats do what they want to do and feel like they own you, I would say rabbits even more so. It is crazy. But Bum Bum, I'm the director of 5 departments. She don't give a darn. If I don't give her food, she'll thump at me. Also entertaining. So this is a text. Your rabbit eating tricks off the ground, blatantly ignoring decades of admonishment to the contrary. Silly rabbit. These are for kids, nice. Okay, pause for pets. Making time for stillness. This is Nimbus. Nimbus is a Russian blue cat. He was free. One of the best free things I've ever gotten. Coworkers, what did you do on your staycation? Me. Sleeping with a cat. This is Nimbus sleeping on my arm when I tried to use my mouse and work while on PTO, stopping me. Pause for pets. This is Zephyr. Zephyr is a tiny, tiny cat. He spends a lot of time staring at things that I think are not there. So seeing the unseen. I do want to move along. I mean, this is fun, but I want to make sure we get to the other stuff. Pause for pets. Forced to exercise. These are 2 standard poodles. They are big, big dogs. Not as big as like a Rottweiler, but they're plenty big. Get home, I am so tired. Oh my gosh, over 5 departments, I gotta just do nothing. Nope, dogs will not let you do nothing. Minimum 2 to 3 mile walk, minimum. Silly and serious, so there's 2 dogs. One of them is silly, one is serious. Let's see if you can figure out which is which. Okay. All right, I saw some nodding for the rabbits, so 1 or 2 rabbit owners. Any crazy fish ladies or crazy fish guys? Funny thing about fish, so they've done some studies on pets. They can lower your blood pressure, increase your life satisfaction, expand your lifespan. We tend to think about it with companion animals and pets like dogs, maybe cats, maybe rabbits. And they actually studied people that interact with their fish and found many of those benefits can happen with fish. So if you're someone that can't have mammals, can't have those kind of pets. Fish can meet some of the benefits. I'm gonna do just a quick 2.5 seconds of our actual fish tank, see if it relaxes you. That was it. Did you see him move or was it too far away? Okay, cool. There's a couple of articles if you want to read more. Listen to your mind and your body. If you do not listen to your mind and your body, bad things will happen to you. Not to me, but to you. So Central Prior Authorization Team, as I said, the launch date, within the first 5 years, the original Dirty Dozen, the original 12 folks, none of them turned over. We finally lost one in March of this year. She retired after 42 years at the organization. My motto for this group is keep it fun, but get stuff done. And also my big goal is to remove barriers and obstacles to their success. As far as supporting staff and coworkers, money. When I say money, people like money. So let's try it. Money. People like money. I classify them as a tech specialist, so that's a level 3 tech, so they're going to make more per hour than a tech 1 or tech 2. Non-monetary could be flexible scheduling if you can do it, work from home, pleasant work environment, and find the fun. Personal involvement, helping them with training, being a good listener, giving space for leader with a small L, meaning they don't have the title, but they do act as leaders. Servant leadership. If you come to me and you say, hey, I need Post-it notes, I need whiteout, I need pens, instead of just getting them delivered and having them put away in the office cabinet, I'll make sure to remember who wanted it and I'll bring it to their desk and give it to them. Serving staff at potlucks and staff events. Sharing successes, sheltering them from blame, and letting your staff know they are important. Food, Flamingo Fridays. I put on a flamboyant, super bright Hawaiian shirt with flamingos on it. I bring in donuts. Always have candy in my candy ball on my desk. Do an annual barbecue or a barbecue for staff. Celebrating life events. And then veggie platter. I put that in because I notice certain people, they never eat the donuts, they never eat the candy. Well, it turns out that they have diabetes and they just don't want to share that. So making sure they have something to make it special for them. Chameleon, kind of figuring out what's important to different people, trying to provide that when you can. Halloween, this is a good example of find the fun. So here's some of the Halloween costumes. I'm dressed up as Tigger from Winnie the Pooh. And one of the employees actually posted on her digital media a picture of me and her. It says, my boss man, Aaron the Tigger. Sharing the success as you win awards. Make sure to bring people along. It's great to bring your boss, but also make sure you bring on some folks that do the frontline work, since they're doing the hard work every day. Potluck pictures. We do a lot of potlucks. Food, food, food. Chameleon, figuring out what's important to different people. Not changing who you are, but just making sure that you reflect what it is that people want in a boss or want in an employee. So to the organization, my boss's boss wants to see me in a sport coat looking professional, whereas my staff sometimes, not always, but want to see me as a Tigger bouncing around. Organization, very happy with the award. The award sits in a case. My staff mostly doesn't care. They want to make sure their favorite candies are in the candy bowl, or around Halloween is the big spider and the 2 rats coming out. Life events. If you do not want to get pregnant, do not drink the water, is our joke. And for those of you that have time at the mixer, remind me, I'll tell you a couple of really heartwarming stories about don't drink the water. This happens to be babies. We get a lot of babies, but we celebrate other things. We celebrate weddings. In one case, we celebrated a divorce. She was like super happy about her divorce and wanted to celebrate it. Okay, do you. All right, moving on to the organization. So the organization, it's important to know what is important. What meetings, what events, what things do you need to go to? And what do you not need to go to? Because you're going to get invited to a lot of stuff and you won't have time to go to it all. Comic above is at a meeting, says we need to get more work done and have fewer meetings. Any ideas? I got one. Know what you don't have to go to. Predict the predictable. If your boss always hits you up Friday afternoon, the last Friday of the month, and asks you for a bunch of reports, just start assuming that's going to happen. Don't wait for them to ask. If you know at the end of a quarter, you always have some thing that comes up, plan for that. If you can predict it and other people can't, then you put it in your schedule. Looking at metrics, what is measurable? I like to see what's easily measurable. If you can measure it, but it's a really, really hard information to get, maybe keep looking. Productivity, unit of service, key performance indicators. We'll talk a little bit about that. Money. People like money. Yeah. Know your audience. So below, the profits are going down, down, down. The big boss is scowling, and the younger associate said, well, it's important to note we're trying really hard. He did not know his audience. And then something I like to call make it professionally personal. So here's an example of the metric dashboard from 2022, and I'm going to show the first 3 quarters of 2023. So this is the one for the compounding pharmacy, CPPC. And you can see it has number of products, number of tags, and number of trays and kits, and who is responsible for it, how they pull the data, and then running year-to-date total. Also, our AVP, our Assistant Vice President over Pharmacy, he loves basketball, loves it. Teaches youth basketball, goes to Final Four every year. He is such a hoop head. He loves basketball. So when it came time to do the annual summary in a PowerPoint slide, and we had to choose the motif, we chose basketball. He was riveted. He was on. He had basketball themes, had basketball background. In this case, one of the things we went over was actually cost savings because people like money. Here's SSRS. This is the float pool. Again, showing the metric, showing the data source, and then making it important for the sites that use it. We can divide it up and show them how much staffing is going to your site for pharmacists or for techs, how much staffing is being used that uses overtime, building that in so that it's meaningful for them instead of them just feeling the loss when they ask for staff, but we don't have any to give. Telepharmacy, looking at meaningful metrics again for that group to drive their performance, but also for the customers, which are besides the patients, which are the hospitals. And then for each hospital, giving them a breakdown showing over time how the percentage of orders that have done have gone up. Also breaking out weekends because they said, well, the service is good during the weekdays, but on the weekends, we're skeleton staff, we want more help. So we started tracking that and showing how we were providing better service on the weekends. Central prior authorization. This team is really near and dear to my heart since they were ones that I launched. They're kind of like my babies and then my toddlers, and now they're my teenagers running around. Not always doing what I tell them, but becoming strong and independent. So in this case, one of the things you have to look at is you can't always keep the same metrics and keep them the same way. If you look at the in-basket messages process, it actually dropped off starting in March. And that's because we transitioned from doing our EPAs, our pharmacy-based prior auths in-basket to a work queue. So that'll have to transition next year to be a work queue metric. Also looking at denial recoveries and denial reductions. Again, money, because people do like money. It's weird. Looking at increases of CAMs, clinic administered medication referrals processed over time, and EBMs. These are infusions, things like oncology and others. Breaking out, these are the denial recoveries where we actually overturn denials that Rev Cycle and Business Office are not able to do because we have the better knowledge of drugs. And then showing how it stacks over time. CAM denial reduction. This was looking at the run rate for denials for clinic administered medications that were non-EBM medical CAMs. And again, showing within the last couple fiscal years, and then we're about to finish up this one, how we're reducing denials year over year. Patient assistance, financial assistance, relatively new team, but again, starting out with 3 metrics. We can have more like turnaround time and other ones coming up. For now, the focus, a lot of it is on money and free drug, cost avoidance, grants, and revenue. And then because Scripps is a nonprofit, we're actually required to do a community health benefit. That's required as part of the regulations for being a nonprofit. And so I just started to look and see, hey, who does this community health benefit? Who are the folks that write it every year? And then I reached out to them and said, hi, you don't know me, but I work at Scripps with just like you do. I have a team that does amazing things for our patients. And I'd like to get into the community health benefit report. And they said, okay. So this last year, we actually had 3 paragraphs that were dedicated to that new team. So quick reminder, our objectives were to stay awake and to learn. For many in healthcare, conflicting demands on your time with finite resources. We want to discuss ways to balance what you focus on, how you can get outstanding outcomes for your organization, operations, your staff, your patients, and yourself. With 1, identifying at least one tool or technique for improving operations that you can implement. 2, recognizing the importance of yourself each and every day. 3, discussing ways to improve engagement with your staff. And 4, reviewing metrics that can demonstrate to your organization what your relevance is and what your key performance indicators are. And the question is, can you turn this into this? It's me juggling in a cutout. So I think you said we had about 5 minutes left. Was that right? 2 minutes. I have 2 minutes left? Does that include question and answer? Oh my gosh, I've talked too much. You guys should have shut me up. I got you. Okay. Well, so we have 2 minutes for questions. I'm happy to take some. Or if you don't have them, yes, ma'am.
Hold on. Like 30-year-olds, money, money, money. But we also have in our organization 60 plus, I'm a part of that group, 70 plus, where their motivators are wanting to help, be involved. The 30-year-olds, when is my next race? Sorry, no. You know, they're just different motivators. And
Yeah.
how do you manage a diverse age group? Send me an email, text me, give me a piece of paper and I'll do it. So there are 3 different age groups. So when everybody said money, money, it's not so in the organization that I'm in. They just want to help over 65 and want to be advocates.
Yeah, no, for sure. That's a great question. So I do have some age diversity with Jeanette retiring, not as much as I did before. You're absolutely right that money doesn't motivate everyone. And people's communication preferences can be vastly different, even within the same group. So some of that is trying to tailor what you message and what you provide to the individual as best you can. I will say that some things like job security seem to be very universal, knowing that they're important, that they're successful, that they're seen as valuable by the organization and yourself. But I'm happy to, we can hang out later and over a soda or a beer. I'm happy to talk a little more about that. But for sure, people have all kinds of different motivators. It is not only money. But I will say where we live, it's a very high cost of living. The folks that are pharmacy technicians are way underpaid for the level of training and expertise they have. And so that's, part of my struggle, why I look at money. And then for the organization, part of it is understanding in lean times, how do you show your value? Because it's clear that some of these that do prior authorization financial assistance have value to patients. But if you're making cuts, you have to show how it's valuable to the organization. Yeah. Good. We have time for one more question? All right. Well, thank you so much for your time. I really do appreciate it. You guys are amazing. And just come grab me if you need anything. And my phone number and my email are there if you want it.